Heart disease is a major contributor to the death toll every year. I would bet that every one of you either has or knows someone who has heart disease. With the rising cost of health care, we can identify risk factors and preventative measures for heart disease. Now, with all of us living in the age of modern medicine and having access to the internet, personal health care professionals, and infinite studies spouting numbers and information that is hard to understand, gives one the ability to utilize and self-research materials from credible sources, enabling me to present this to you. For this topic, we will review three main points: what heart disease is and its components, cost analysis for heart disease versus other issues, and how as individuals we can reduce its effects. Now that you know what we're going to be reviewing today, let's take a look at the facts. What heart disease is and its components. There are many types of heart disease, including coronary heart disease, which is a blocked or clogged artery which limits blood flow to the heart and starving it of oxygen and nutrients. This action is called a myocardial infarction, or as we know, a heart attack. The blocks can be from a dislodged piece of plaque or an air bubble. These also contribute to heart disease. Arrhythmias. Arrhythmias are an electrical disturbance that cause a heart to beat irregularly. Heart failure is when the heart cannot pump as powerfully as it needs to in order to supply the body with oxygen and nutrients, causing the heart muscles to overwork and weaken. Heart valve disease is when one or more of the heart's valves, which control blood flow in, around, and out of the heart, don't work properly. Cardiomyopathy. That's a big word. So here's what it is. It's an enlarged or abnormally stiff or thick heart, causing the heart to pump weaker than normal and sometimes leading to heart failure or an arrhythmia. Pericarditis. Pericarditis is an inflammation of one or more layers of the pericardium, a thin membrane that lines the heart. Aorta disease. Aorta disease is where a portion of the aortic wall weakens and balloons out, forming an aneurysm. And last is vascular disease. Vascular disease is a heart disease that is often related to diseases of the circulatory system, including arteries, veins, and lymph vessels or blood disorders. You might have heard of these. You might have heard of arteriosclerosis, or hardening of the arteries, or atherosclerosis, or buildup of fatty deposits and other particles on the inner walls of the arteries. Now that we've touched on a few definitions, let's take a look at some of the costs that are incurred with heart disease and how they relate to other diseases or obtained medical costs. In 2008, coronary heart disease alone cost the U.S. $108.9 billion. In 2010, it was estimated at $316.4 billion in healthcare, medicine, and lost productivity. That number tripled in just 2 years. The national cancer care expenditures were estimated at $124.6 billion in 2010. So as you look at those numbers, double the amount of health or heart disease versus cancer. I always thought that cancer would be a big one, but it's half of the amount of heart disease. So a new CDC data analysis, which is CDC is the Center for Disease Control, data analysis looked at the cost of motor vehicle crash deaths by state and found that half of all the costs were found in 10 states. The 10 states with the highest medical and work loss costs were California at $4.16 billion, Texas at $3.5, Florida at $3.16 billion, Georgia $1.55 billion, Pennsylvania at $1.52, and the list kind of goes on and on and on. So as you can see, heart disease is triple the amount of cancer and vehicle crashes for the year. And now that we've looked at several items that our country's billions of dollars cost in comparison to heart disease, the question is, where can we expect to be in 5 years? We as humans have a brain that can produce thought to reduce the amount of deaths and diagnosis of heart disease. Personal choices we make every day affect the outcome of our health. We can lower our risk for heart disease and other debilitating diseases by accomplishing just a few simple lifestyle changes. Quit or reduce significantly the amount of tobacco products used. Eat the recommended dose of fruits and vegetables. Exercise. Avoid salty and fatty foods. Limit the amount of alcohol ingested and get regular medical exams. When you go to the doctor every year, it's good to get an annual checkup. Ask your doctor to screen for the risk factors. Have your doctor test for blood pressure manually. Most times, and manually is an important point to make on that. Most times the automatic ones that you see at Walmart or the grocery store have been overused without a regularly scheduled calibration. So also have your blood drawn for your blood glucose levels. And that's kind of a tongue twister, or BGL as we call it in the medical field, blood glucose levels, to test to see if you have a potential for diabetes or not, and your cholesterol levels. Also evaluate and discuss your body mass index to see where you range, if you are overweight, if you're underweight, or if you're kind of right on track where you should be. I have a chart here that shows the percent of deaths from heart disease in 2008 broken down by race. And as you can see, the Hispanics were second to the lowest, to Native American Indians, African Americans, Asian and Pacific Islanders, whites, and all others. So in 2008, obviously we have a chart there that shows, it's culturally diverse disease. Also is the #1 cause of death in the United States for both men and women. So it is necessary, if necessary, there are a multitude of high blood pressure and high cholesterol medications that are available to control such issues if you have them. Some issues are passed on through genetics or heredity, but most are self-induced by lack of good nutrition and exercise. Let's recap on the material that you have seen and break it down to the down and dirty. So, heart disease has been the leading cause of deaths for both men and women in the United States for many years. As we, conscious, educated adults, have the ability to control what we consume, allow daily exercise in our schedules, and seek medical advice for our overall health condition. We also have the moral and ethical responsibility for our future generation to educate them as to the causes, preventative measures, and treatments to prevent heart disease. Heart disease is a costly and productivity robbing disease that comes in many forms that spans all age ranges, gender, and races. So in closing, don't be a statistic. Take care of you and your family's health for today, tomorrow, and a better quality of living in the future.